So one thing the viewers will be wanting me to ask you is how successful was the operation and what did they actually do? Because I know there's a variety of operations from simple to very complex in relation to bowel cancer. Do you know the site of your tumour?
Yes, it was on the transverse colon.
And how successful was the operation? For example, I mean, this is not necessarily just a measure of success, but it affects people's lifestyle. If you have to have a stoma, for example, or if there's any alteration to the bowel habit, you know, there's a variety of complications. So what was the situation for you?
I was told before the operation that I might have to have a bag, stoma bag. And to be honest, at that stage, I wasn't bothered. I just wanted to be well. So I thought, hey, you know, that's not the end of the world. So that's the first thing I asked when I came round from the operation. Do I have a bag? And she said no. And the surgeon said they'd taken the tumour away, put everything back together again, and he said to me, you'll feel so much better than you've felt for years. Because I said how I'd been going backwards and forwards to the surgery. He said life will begin for you now.
Just skipping ahead, do you believe that was the case in terms of your overall lifestyle?
Oh, now?
Yes.
Yes.
It was a marked improvement.
Well, me and my husband, we both knew. I knew I was ill, and nobody would. It was like hitting a brick wall.
Yes, those pre-existing symptoms were basically improved. But we're skipping ahead because I was asking you about the surgery.
Yeah.
And what about the change in bowel habit or eating pattern or weight? Was that affected either immediately in hospital or later when you returned home?
Well, initially after the operation, the last thing you thought about was going to the toilet. So the nurses did say I couldn't get home unless I had a bowel movement. It was a standing joke. She would have to measure it with a tape with a measure. Not a nice job, I admit.
No.
But and she used to say, any news, anything? And I'm like, no, and I want to go. So obviously they wouldn't let me out until they knew everything was functioning properly. I even used to say to visitors, can you please go in the loo and do a sample for me? Because I'll never get out of. But anyway, after a few days, obviously I didn't feel like eating for the first day or so, but my appetite increased, and yes, I did produce something for her, and I was eventually let out. But yeah, we used to have a joke about that.
Now, did your bowel habit change at all? Because sometimes when you have bowel removed, it changes the absorption of certain foods, particularly high-calorie foods or high fats. That kind of thing.
They put me on. I saw a nutritionist, and they gave me a sheet. It wasn't a diet sheet, a low residue diet. It was weird, really. It was opposite to what I'd been having: white bread, corned beef. No porridge, nothing like, no fibre, no fruit.
These are all foods that have what they call high glycemic index, which basically means they're very easily absorbed.
Yes.
So it was being kind of gentle on your bowel.
Yeah, to give it a rest almost. They'd want it to. But then gradually, I got back to normal. I mean, obviously there'd be a few. I do like curries and things, and it's not advisable, but sometimes I'd be a bit naughty and have...
And did you suffer with that breaking of the normal habit?
We have 3 toilets in our house, and they did come in useful, and I knew that if I had a curry, I didn't have a lot, that I'd have to be fairly near to the toilet.
So to put it in a nutshell, you had to be careful about what you ate.
In the early...
If you followed the rules, you were pretty much okay.
Yeah.
If you broke the rules, you did suffer a little bit.
Which now and again, we did. I had a nice curry house where we used to go, and they were all very nice. And I used to say, I can't eat a lot. No. So I used to just have what my husband had, and lots of rice, and just take some of the juice.
What about the volume of food in general? Was that very much reduced or pretty much
the same? No, you can't have a massive meal. It was quite uncomfortable.
Yeah.
But I didn't mind that. It was early days. I didn't expect to be, rushing into 3-course meals.
Yes.
I was just happy to be all. The main thing was I was okay.
Definitely. So that's the
Food
message,
was
really, isn't it?
Yeah, as long as I had.
You were concentrating on the cancer being removed and getting back your basic health.
Yeah, I surprised myself. I was quite positive. It was like a roller coaster. I was like, right, okay, and you get in this weird mindset where you just focus.
So it sounds like you weren't too worried or anxious about the specifics, of having the treatment or, going for the operation. Or
I didn't have time to think because it was so quick. From being diagnosed with the cancer, 2 to 3 hours later, I'd even had food, a sandwich, and they said, well, we have to operate now.
Yes.
So it was. I didn't have. I'm sure some patients might have that thing where you've been diagnosed and then you wait weeks.
Definitely, that's
nothing.
Much more common actually. And what you're saying,
I preferred it the way.
Yeah, for us as doctors, that if you get on with the process of treatment as soon as possible after the diagnosis, it stops a lot of untoward anxiety happening.
Yeah, I mean, we were both upset, obviously, when you think you have appendicitis or something, to be told you've got cancer, because that was never in my psyche. Because, as I said, nobody in the family had ever had cancer, so you don't think we were all Alzheimer's and strokes and heart attacks
in the family.
Cancer never even came into it. So I was very focused. Once I was like, right, okay, I'll sort this. I was quite positive.
Good.